Welcome, it's Facts You Don't Know. If it's your first time here and you want to find out new facts that will definitely make you smarter and more, and first make sure to subscribe and activate the notification bell so you don't miss anything.
A baby born in Hong Kong was pregnant with her own siblings at the time of her birth, according to a new report in the infant's case. The baby's condition, known as fetus in fetu, is incredibly rare, occurring in only about 1 in every 500,000 births. It's not clear exactly why it happens. Weird things happen early in the pregnancy that we just don't understand, said Dr. Dran Birch, an obstetrician and gynecologist in Pittsburgh, who goes by Dr. Dre. This is one of those medical mysteries. The World Health Organization considers a tiny fetus found within an infant to be a kind of a teratoma, or tumor, rather than a normally developing fetus. But the doctors who treated the baby girl wrote that rather than a teratoma, the tiny fetuses may instead be the remains of sibling twins that were absorbed during the pregnancy. The newborn baby was referred to Dr. Yu Kai Man, an obstetrician and gynecologist at Queen Elizabeth Hospital in Hong Kong, because the baby was suspected to have a tumor, according to the case report. The mother's prenatal ultrasound had revealed an unusual mass within the infant, but it was unclear to the doctors exactly what the mass was. During surgery, which was done when the girl was about 3 weeks old, the surgeons discovered 2 fetuses between her liver and her kidney. One fetus weighed 0.3 ounces or 9.3 grams, and the other 0.5 ounces, 14.2 grams, corresponding to about 8 and 10 weeks gestation, the report said. Each of the babies had an umbilical cord that linked to a placenta-like mass in the girl's belly. The baby girl was obviously too young to have conceived the fetuses herself. Instead, it's likely that the girl was once one of triplets, the researchers said. Then, for some mysterious reason, the 2 smaller fetuses were absorbed into the body of the remaining child. The fetuses would likely have still been alive and growing when they were absorbed into the surviving baby's blood. Once there, however, their development couldn't proceed normally, Birch said. They need placental flow and all that other stuff to really grow, Birch told Live Science. Fetus in fetu may in fact be similar to a surprisingly common phenomenon, vanishing twin syndrome, Birch said. In many twin pregnancies, one of the twins is completely absorbed and vanishes into the body of the other. When you do a delivery and you see an extra placenta and a cord, you say, "Oh, it must have been a twin," Birch said. Fetus in fetu has been reported in about 200 cases in the medical literature. In 2006, doctors in Pakistan removed 2 fetuses from a 2-month-old girl named Nazia, according to NBC News. And in 2011, an 18-year-old boy had his retained twin removed in a major surgery, the Seattle Post-Intelligencer reported. In rare instances, fetuses that die in utero can become calcified and turn into stone. In August 2014, doctors in India removed a lithopedion, or stone baby, that a 60-year-old woman had carried in her body for 36 years. She went to the doctor complaining of abdominal pain and a lump in her lower belly. Thanks for watching. Please like and share the video in social networks. We'll be right back to you as fast as we can.